It's 5 a.m. and you're watching Fox 31's Good Day Colorado with Shaul Turner, Steve Kelly, meteorologist Crystal Egger, and Ken Clark with traffic.
Well, there have been many improvements in breast augmentation, but some women still worry about what can happen once the breast implants are in. Up next, there's Dr. John Torres. He has information about new implants that will never leak.
But years ago, dangers that silicone breast implants could leak had women staying away from the breast augmentation procedure. Since then, silicone has gone, but now it's come back again, but it still worries plenty of women. Well, there's some new implants out there that are a lot safer, and to help me talk about that, we have local plastic surgeon, Dr. Terrence Murphy. He's here to talk about breast implants, basically the safety behind them, and kind of the new products they have out. And Dr. Murphy, thank you very much for being here today.
Thank you, John.
I appreciate it. So, right off the bat, the first question I get all the time is, silicone years ago got a really bad name.
Yes.
And now it's back. Is it safe for women?
I believe they're very safe for women. I think one could argue that silicone breast implants are the most studied device in the history. Over thousands of studies have been done all around the world looking at the safety of these implants. The National Institute of Health, Institute of Medicine came out with a 400-page report in 1999 documenting their safety. They're supported by the editors of the New England Journal of Medicine, and I feel very confident.
Okay, and I know one of the big issues they had a while ago is, not only the safety behind it, but the fact that they leaked once they were in sometimes. And that leaking caused problems, especially when they were trying to remove these implants.
Yes.
But now they have new breast implants. One of them is called a gummy bear, is the kind of the generic name for it.
Yeah.
That don't leak as much. So talk a little bit about that.
Well, as the generations have come along, we have new implants which have a thicker gel, more cohesive, and a thicker shell. And the ones we're using now, you can see is here.
We have a little show and tell here.
Yeah. This implant I made a hole in. And you can see this is the one we use now, which is on the market, not the gummy bear one. You can see that if you squeeze the implant, the gel is there, it's stuck together, and basically stays in the implant. Even if it does leak, it's all stuck together and much more easy to remove and replace. In the future, the FDA is now looking at a style 410 implant produced by a company called Allergan. It's a very popular implant all around the world. The FDA is closely studying that now, and hopefully in time will become available. It obviously will offer us some other benefits. It's more cohesive. It will retain its shape better and help us to give a different shape to the breast.
That's a big issue here. I mean, if you look at the show and tell we have here with the different breast implants, if you look at them, some of them don't retain their shape very well. They flatten out. But this one, the 410 you're talking about, stays fairly well formed.
It does.
Which is important for the woman, obviously, when she has the implants inside.
Especially people who want more upper pole fullness, perhaps. I've followed a number of these patients in my office over the years, and they're very happy with them.
And one of the things that you and I were talking about before we came on air is the fact that there's two things to look at when you're trying to decide on what type of implant you want. One of them is the size of the implant, but the other one is the shape of the implant, because there's a difference between being on a table and getting it put in and standing up and walking around everyday life. So talk a little bit about that, about the different shapes.
Well, the number one determining factor as to how the implant's going to look and the satisfaction of the patient is the volume of the implant. But people have different shaped breasts. These three implants are all the same volume, but they have a different shape. Some people have a wider breast. This implant will fit better. And then as they have a narrower breast but want more volume, we can use a higher projection. And there's kind of a basic rule of thumb that the highest projection might go up from 1.5 to 2 cup sizes. This is more 1 to 1.5 cup sizes, and we don't use the lower profile mostly, so kind of the moderate and high profile we use the most. It's just another way we can customize the procedure to the patient to improve their satisfaction.
And this is a tough question to answer in the limited time we have, but if a woman's looking for a breast implant and she's looking at saline versus silicone, what do you tell them to help them decide?
I think one of the important factors is kind of the ratio of breast tissue to breast implant. Women who want larger implants and have less breast tissue, I think, probably do better with silicone. There's issues about maybe rippling of the implant, not quite as natural look with saline. Silicone can be better. Women with more breast tissue and don't want a larger implant, I still think saline's a great choice for those women.
Great. And you were telling me the average cost is $5,000 to $8,000?
Between $5,000 and $8,000 in our city.
Okay, excellent. And if you'd like more information about breast implants or Dr. Murphy and what he does at his clinic, you can basically get it in a link to our, let me try that again, you can get it from a link we have on our website. You can link to his. You just log on to myfoxcolorado.com. You can look for it on the As Seen On tab. And Dr. Murphy, thank you very much for being here. And this answers a lot of questions that I know I get every day in my clinic. So.
My pleasure. Thank you.
Dr. John, thank you. Staying on the surgery vein, it's something that a pet owner would definitely want, a virtual pain-free surgery.